Good morning. I'm Courtney Drescher, Vice President of Member Engagement at the Tulsa Regional Chamber. I am joined today by Kristi Spaethe, President of the People Perspective, and Kirk Turner, Shareholder and Practice Group Leader for McAfee Taft. Making sure your employees are engaged, productive, and set up for success can present challenges even under normal circumstances. So Kristi and Kirk are going to talk about how to lead employees to meaningful and measurable outcomes in a very uncertain reality. Kristi is the president of the People Perspective, an HR consulting firm dedicated to helping organizations realize their best practices in human resources. With over 15 years of experience in the HR industry, Kristi specializes in organizational development, leadership development, and custom HR solutions. Kirk Turner is a shareholder and practice group leader for McAfee and Taft. He has more than 30 years of experience representing companies and management in all aspects of labor and employment law, with specific emphasis on litigation before federal and state courts, regulatory and administrative agencies, and in arbitration matters. Kristi and Kirk, I'll pass it over to you.
Great. Thank you so much, Courtney. We are so excited to be here and talk to you about engagement, accountability, and results. So I'm going to kick us off here, and we'll let Kirk wind us up with the legal piece of this. But before we really dig in, I want to share a graphic with you that I found to be pretty helpful through this pandemic. This was a graphic shared by a Harvard Business Review article that Amy Cuddy then shared on LinkedIn a bit later. This was shared early April, May, I believe, that time frame. And again, I found it to be really helpful in understanding what our employees are going through. So the stages of a crisis are first emergency. So the emergency stage of a crisis, I think of as the adrenaline stage. If you think about where you were at when we first started here, there was so much energy about figuring out what we needed to do with our businesses, how we pivot, what we do with our employees. After that stage, we move into the regression stage, which is the stage of exhaustion. That's how I think of that phase of a crisis. And I can remember probably the first time that I hit that regression stage. We then hopefully move into the recovery stage, which is the final stage of a crisis. And I think that it's important to remember, I don't know about you, but I've moved through these three stages I don't know how many times since March. So if I'm moving through them, Kirk gave me a nod there, so I assume he is as well, then your employees are too. And it's important, that's what this is about. It's important that we understand where they are so that we can meet them where they're at. I think whenever I talk to leaders, pre or post pandemic, it's our job to meet our people where they're at and give them what they need. So I wanted to show that to you to kind of set the stage for how we're going to move through this today. Let's start off by talking about employee engagement. You see the components of employee engagement up on your screen. Here's what it impacts. So employee engagement impacts all of these things that you see, a huge impact. So a huge impact on your organization with how engaged your employees are. That's kind of a buzzword that I think has been thrown around a lot, but there's some science behind it. So let's talk about the science. This is all kind of setting the stage for us to talk about how we keep our employees engaged during and after a pandemic. So Gallup, we've probably all heard of Gallup. They do all the studies, scientific, great information. Gallup has been polling employees across the United States for many, many years on engagement. And through these studies, through these polls, they've created these three categories of engagement. So their research has shown that employees usually fall into one of these three categories: actively disengaged, not engaged, and engaged. I think of the actively disengaged employees as the poison. Have you known? Yeah. I bet you've known them.
For sure. They're your workers' comp professionals. They're your folks that are trying to figure out how not to work instead of just coming to work.
Yeah.
And they're the folks that are creating an atmosphere of fear and retribution and us against them.
Yes.
Those are the folks that are actively not engaged.
Yes. Yes.
And are looking to go work somewhere else.
Right. So they're miserable. And it's not just that they're miserable, it's that they want everybody else to be miserable as well, in my experience. So those are the actively disengaged. And luckily, Gallup shows that those are the smallest percentage of our employees across the United States. The next category is the not engaged employees. And I think about these people as the paycheck people. So they are just there for a paycheck.
Right.
It's a job.
Yeah, they're not committed any longer than the paycheck lasts, and we see them as folks that are also the people that will start your union. They're the folks that are looking for protection. They're the folks that are trying to figure out why are we not getting everything that we deserve.
Yes, good. And then lastly, we have your engaged employees. These are the people that we want. Typically, they're rock stars. They go above and beyond. They have that loyalty that you talked about. They're telling their friends about how great it is to work within their organization. These are the people that you want.
Yeah, and fortunately, that's most people in your organization. Most people come to work, want to do a great job for their people. They want to grow. They want to develop. They want to be promoted. And those are the people we've got to really focus on as it relates to helping develop, because those people are actually going to move the engaged or unengaged to engaged. They and the leadership team are the key to sort of driving organizational change.
Absolutely. So I want to share some numbers with you. And we're really just going to talk today about the engaged percentage. So the percentage of employees across the United States that are engaged according to Gallup's polls. You can go look on Gallup on their website to get all the rest of the numbers, but I really just want to share the numbers regarding, again, the engaged employees. And it's really interesting. I mean, before I even tell you what the numbers are, I'm going to tell you that I'm still figuring this out too. There are so many variables at play right now, especially when it comes to engagement. So prior to March, it was actually the 2019 study that they did. They showed that 35% of Americans polled were in that engaged category, those employees that you want, 35%. In, in May, yes, that number was at 38%. So we went from 35% pre-pandemic to 38% in May. I think that's interesting, and we could probably come up with all kinds of theories for that. But I think that there were some people, coming back to work in May. There were also a lot of people still at home that had maybe started to kind of find their rhythm working from home. So it's just interesting that it went up. Here's another interesting piece. In June, the poll showed that 31% were engaged. So we fell by 7%. And that's a couple of years low for engagement. And how Gallup explains that is that that's really about, probably more about the racial tension, the racial injustice that was happening around that time. We're now at 40%. 40% as of August are polling as engaged. So again, I think that our organizations have pivoted. A lot of them have done a really good job of communicating with their employees. We've provided some opportunities for open forum discussions. And so I think that might be why that number has gone back up.
Yeah, I would also say that I think there was just fear. I think there was fear of the unknown, and we don't really know what's going to happen to our jobs or to our organization. Are we going to have to go through bankruptcy? There's a lot of uncertainty. And then I also think that as things started reopening, people were, again, I think some of the racial tensions for sure, but I also think this movement from, I've been doing great at home, why are you moving me back to the workplace? Why am I having to go back? And again, people have health conditions, they're concerned about that, or they're a particular age, they're concerned about that. So I think, again, if you dove deeper on why we had this shift in engagement, I think a lot of that was just really uncertain, because employees like certainty. I mean, we all do. We all like certainty, and we feel better. And that's one of the things I think you're going to talk about, Kristi, is this leadership creating certainty, leadership creating a place where people really want to come, want to be a part of, want to grow, all of those things.
Yeah, confidence.
Yeah,
I think
for sure.
inspiring that confidence.
Yeah.
Before we talk about what you can do, now to this point, I've just kind of set the stage with what engagement is. Before we give you some tips, I want to remind you, and you know this because you've heard it, people leave people. So the number one impactor on engagement is leadership. That is the number one impactor. We hear, well, no, it's, we're motivated by money or we're motivated by job security. At the end of the day, we leave leaders. We don't necessarily always leave companies. We leave leaders.
Yeah, I've looked at tons of surveys on this issue. If you look at why people leave, money's about 7th on the list. People want to be paid competitively, but that's not the reason they work at their particular. They leave because they don't feel appreciated. They don't feel engaged. They don't feel respected. They don't feel safe at work, and that's all leadership. That is all. What are we bringing as managers and supervisors and executives to our particular organization?
Yes. Yeah. Okay, so now let's talk about what you can do about this. So how do we keep our people engaged? You've got some tips and tricks up on the screen. Really, nothing rocket science here, but great reminders of things that we can do. Take care of your people. What does that mean, Kristi? That's such a big phrase. It means do those things on the screen. Check in. It's okay. Somebody said early on, we do a lot of, we know we're supposed to say, how are you? How are you? I started saying, no, really. I'm really asking. I don't just want the fine, good, I'm getting by.
Right.
I really want to know how you are. And it's okay if you say, not good. I'm not having a good day. Give your people that space. Check in means ask them really how they're doing and intentionally check in. So if you're having one-on-ones, we'll talk about that in just a minute. Do it more often. Make sure that you're carving out that space to really check in with your people and give them that venting space if they need it.
Sure.
Yeah. If you have an EAP program, use it. If you don't, call your broker, call your insurance company, call me. We can talk about it. EAP is such a valuable resource right now. EAP is Employee Assistance Program, and it provides free confidential counseling to your employees, usually in a number of sessions. The counseling can be family, marital, individual. So check that out if you don't have it. If you do and you haven't heard from your EAP provider, that's not a good sign. You might want to shop EAP providers. They should have checked in with you by now. I have a client that does a great job with this. They provided special training for their managers. EAP came in alongside and helped co-facilitate that. They provided sessions with their employees. EAP, again, came in. If you don't have an EAP plan, that's okay. If that's not in your budget, that's okay. There are so many free mental health resources available right now, and they are more easily accessible than they have ever been. So again, if you need a list of those, I have a list, but there are so many free resources that we can provide to our employees to help provide that support to them.
Yeah, the only legal issue that you should think about is, we got to be careful about how we're documenting these issues. Again, if people just need to go see someone to have a discussion, one thing. If you think they're depressed or you think they've got some health condition and we start sending them the AP, then we've got some potential ADA obligations as it relates to accommodation. And so we just need to be really careful that we're not communicating in writing on an email that says, she's crazy. We don't do that. We say she needs to go talk to somebody. That's perfectly fine, but we're not going to start diagnosing people medically because we're not doctors. We don't really know what their health condition is. They just told you they'd like to talk to somebody. So that's a great tool. Just got to be really careful because we see a lot of people start diagnosing folks, and that creates some legal risk that they don't want.
Yep. So glad he's here. So then lastly, I'll just say over-communicate. And I'm going to say this several more times as we go through.
You're going to over-communicate?
I sure am.
Yeah.
Yes,
Yeah.
thank you. I'm going to over-communicate about over-communicating. It's a lot of syllables that I just said there. You cannot over communicate to your people right now. That transparent communication is so important. And if you don't know, it's okay to say, I don't know. We're working on it. We'll know next week.
Let me check.
Yes.
Yeah.
Yes. We don't have to have all of the answers ever, but especially right now, if you're not sure, let me check is a great one.
Yeah.
People want to know what's going on, what's happening, what the plan is. If you know what it is, tell them. If you don't yet, tell them when you will, or tell them what you're working on. That goes a long way in inspiring that safety, that confidence, and the engagement piece. When people, if we think about Maslow's hierarchy of needs, that safety and security is number one. If they don't have that in terms of an engagement perspective, then we're never going to get up here to the top of the pyramid.
Yeah, and we're getting lots of folks that are saying, well, you need to tell us when somebody has a COVID situation. And so I think you got to tell people, listen, we appreciate that you want to know, but we can't, tell them what we can't talk about because we got privacy issues, we got health information. We can't go tell people about any particular employee, but we do want to tell, hey, we've got cases, we're dealing with the issues. Those are, I think I totally agree with, can't over communicate these issues. Just like you can't over communicate policies, your return to work stuff, what you're communicating there. We just need to be communicating better. Don't assume that people know what to expect. That's our job as leaders, is to communicate what they should expect.
Yeah, and I think it's really important. I had a client, an employee at one of my clients, that really dug in and wanted to know who it was, why he got the email. So it's not enough to just say, I'm not telling you. I told him why. It's against the law.
Right.
I can't tell you who it is. It's against the law. So I'm not just making things up.
Right.
I'm not just being difficult. I can't tell you because it's the law.
Yeah.
Okay. So let's move on and talk about people performance. So performance management. Let's dig into that a little bit. And again, before we talk about how you move through performance management in a time of crisis, I want to define it a little bit and first tell you that performance management is not just the annual performance review. I've heard Kirk talk about this. I know that he has things to say. The annual performance review is a great tool, but it is not enough on its own. And I will let you talk about the legal implications in just a moment. Performance management is holistically managing the employee's performance. It's not one conversation one time a year. You can do that, but you also need to be doing things like having one-on-ones, checking in, providing real-time feedback. It's performance management is succession planning, talent development. All makes up. Those are all components of performance management. When we just do performance management as the one time a year annual performance review, I'm just going to turn it over to you. There are so many errors that come along and legal risks.
Yeah, big time. So that should be the culmination of all the conversations that we've already had. And there should be no surprises when we're managing people. People should not be surprised that you're disappointed or that you're frustrated or that they're not meeting the mark. They should know it is our obligation as leaders to communicate that. And again, no surprise. And the performance review or the one-on-one, again, is after we've already had all these other conversations and communications and documented. What we're doing as managers and we are creating evidence. We are creating evidence that we had these conversations, that we had these communications, because if we separate from an employment relationship with someone, we have to assume they're going to challenge that decision. We should assume that at 100% clip, that they're going to go file an unemployment claim, go to the EEOC, go to the Department of Labor, go to OSHA, and make some sort of a complaint that the reason they got discharged was not related to their performance. So we are creating evidence. That's what we do as leaders, in addition to care about our people, taking care of our people. So Kristi is talking to you about caring and engaging. We're also talking about leading in a way that avoids lawsuits and charges and paying me a bunch of money, because paying lawyers to clean up your mess is a waste of your money. It just is. So we need to be doing this better and not having to be sued by some employee because we didn't do things right.
I think along with the legal risks, the legal implications, I've gone a year without getting any feedback.
Right.
That does not feel good. I don't know if you have, but that does not feel good. So take care of your people. We just talked about that. Take
Well, and
care
you
of your
think
people
the
and give
worst,
them the
right?
feedback.
You think if they're not feeding, like instead of saying, well, if you were doing something wrong, I'd tell you, I don't hear anything. And so I think, gosh, they don't care about me. They don't. I had a coach tell me, if I stop talking to you about your performance, that means I don't care anymore. So I'd rather be kicked in the tail on an
Yes.
issue and know that somebody's engaging with me than say, I'm not going to have any conversations with you.
Yeah. I will tell you also that some of you have employees that strongly feel like no news is good news. So the opposite of that.
Yeah.
And if you don't tell them that there's maybe some not good news, they're just going to keep on keeping on. And then it's not going to be productive
That's a
or
good
feel
point.
good
Yeah.
when we have that end of the year conversation. You've got some tips on the screen for how to give feedback. That's kind of my process that I train leaders on how to give feedback, have those hard conversations. I'm going to move us along just in the interest of time and talk about how to do this in times of crisis. So first, motivating, engaging, managing performance during a time of crisis, you need to first know your people. And that doesn't mean I know their kids' names and I know when their anniversary is. That means, what are they motivated by? What gets them going? Because we all have differences in that area, and we're allowed to. I talked about checking in, giving them what they need, meeting them where they're at. I've strongly advised increasing the frequency of one-on-ones. I just think that's, again, back to the over-communication. I think it's okay to get, I've had people, clients ask, can I have the hard conversation still? Should I just hold off on those? Can I tell somebody when it's not working, when they're not doing a good job? And I've said, absolutely.
Right.
Maybe we try to do that with a little more understanding and what's going on in their life. They're obviously still employed with us, but their spouse may not be. There are financial implications for many of your employees. So understanding what's going on, but we've got to keep giving feedback.
Right.
We've got
And there still has to be accountability, right?
absolutely.
Employment is a privilege. We get paid to meet the expectations of our employer.
Yes. In the same light, I have had clients ask me if we should continue with our performance management system. So whether that's quarterly reviews, and a lot of companies had annual reviews come up right around the time, March, April. So I know this isn't super helpful, but I've said depends. If you have a very established performance management system, then I think, again, like I just said, carry on with some understanding. I've talked about being flexible and generous a lot through the pandemic. So with some flexibility, with some generosity, but still having the conversations that need to be had. I had a client that was rolling out a new performance management system in March, and I advised against that. I just didn't think that was the time to roll that out. So it depends. But I think it all comes back to, again, that flexibility, generosity, and understand what's going on in your people's lives. So if you are checking in, if you're over communicating, if you're doing the one-on-ones, then you're going to be able to do that.
Yeah, perfect.
Okay. So just a quick word on managing remote workers. I'm sure a lot of you have figured this out by now. Hopefully, I hope you have. Again, I think this is all a little bit of a work in progress. And no surprise, one of the main tips is about communication. So making sure that you're communicating with your employees, also making sure that they're set up for success. If you haven't already, making sure that their home office is comfortable enough for them, that we're not going to have any ergonomics issues. The one that I want to touch on, and then I'll turn it over to Kirk to talk about the legal implications. The one that I really want to touch on here is that I've heard several managers say, I don't trust my employees to work from home. Productivity is going to go down. They're not going to get anything done. I don't know if you saw the meme on Facebook where somebody tied their mouse to an oscillating fan so that it would show active, right? Yeah. So that, I think, is the picture of what a lot of managers have. And if you don't trust your employees to work from home, this could be a pretty strong statement, then we have a different problem.
Right.
We have some other issues that we need to address. So if it's working, I think a lot of companies are seeing an increase in productivity, or at least holding steady.
Yeah.
Then keep that in mind. If you do have an employee that you don't trust, then call us because we can talk about a different way to address that. Do you have anything to add before I turn it over to you, Kirk?
We did a survey at our law firm. We surveyed 500 employers in Oklahoma, and kind of in the middle of the pandemic, and 74% of those employers said that they were going to continue remote working. So that's to me, that's a sea change for what's going to happen in our workplace. So we need to get used to the idea that we're going to have people working remotely. We need to adjust our expectations that relate to that. Not the outcome, not the result, not the performance, but how it's going to be delivered, the flexibility and the generosity that we're going to allow people in the way that they do that. I think it's really important. I would say, as your lawyer, you need to be thinking about, we need to have telework policies that are really clear about what the expectations are, and that we reserve the right to adjust your schedule, bring you back to work. This isn't forever. This is sort of on a as-needed basis. And then in my view, you need to have a telework agreement with each individual employee that says exactly what you expect for those employees. And again, leadership needs to be talking to folks about how we expect this all to work, especially timekeeping for hourly employees. We still have an obligation to pay people under the Fair Labor Standards Act. They're not there clocking in, so we got to have some mechanism to track their time, and all of the other things, delivery of handbooks, delivery of communications, doing one-on-ones, how are we going to do those remotely? All of those things need to be thought about as an employer, for sure.
Let's talk about families first. What do you say?
So we have some legal issues that have come up, and principally revolves around leaves of absence. And the Families First Coronavirus Response Act was actually became adopted in April of this year, and it actually sunsets at the end of the year, December 31, unless Congress continues that particular program. And what it does is it provides leaves of absence in a number of situations that weren't available before the implementation of this law, specifically related to COVID-19 conditions. So it's got to work around COVID. It's not a leave program that for other illnesses. We do have the Family and Medical Leave Act. We have the ADA that provides those types of potential leaves. This specifically relates to COVID. If you look at who it applies to all employers, public and private, with less than 500 employees. If you've got more than 500 employees, you got 1,000 employees, 1,500, you're not covered by this. You're not required to give a leave of absence. Really what it does is it provides paid sick leave, which is really the first time in our history that we've had a congressional act that provides paid leave to employees if they have an illness and they're allowed to be off, then they get paid time off up to 80 hours if they're a full-time employee. It expands the Family and Medical Leave Act to include people who cannot work because of a child care closure or a school closure. Like right now, we've had schools that are going virtually, and so that particular issue, maybe a mom or dad needs to stay home to care for their children because their school's closed, that there would be a leave available in that situation. And then it really importantly for your financial people, it provides offsets, tax credits that you can set off the money that you're paying those employees and really recover it through your payroll tax withholdings. In other words, if you spent $100, then you could withhold on your payroll tax liability $100. So essentially, the government is paying these expenses for you. The paid leave, as I said, it's separate from any existing paid leave. If you've got a paid sick leave program or a PTO program, this is in addition to that, not in lieu of that. So up to 80 hours of paid sick time to employees, again, employers with less than 50 employees, and that's going to be some of you out there in the small business world. You may be exempted. You're going to have to go through the DOL process to get exempted. If you have questions about that, just let us know. And then the right to paid sick leave expires, as we said, December 31. Here are the ways in which you get sick leave. First of all, the employee has an illness that it has an illness, and they are shut in or they are required to be home due to some quarantine, some self-isolation order by the local, federal, or state government. So Governor Stitt issued a stay-at-home order. If he were to issue one, then that may protect your employees in terms of receiving sick pay, in terms of receiving protected leave, meaning you can't terminate them while they're on this leave of absence. The employee's been advised by a healthcare provider, so they've got a doctor or a physician or other healthcare provider that says this person needs to be home to self-quarantine because either they've been exposed or they've tested positive for COVID-19. The employee is experiencing symptoms, so we all now know what those symptoms are, right? They've got a cough, they've got a fever, they've got upper respiratory problems, and they are experiencing symptoms. Then that employee would be protected under the Families First bill. And then the last couple are really important. One is the employee the employee is caring for an individual who has COVID condition or has been exposed to someone. So it's just like the FMLA, you're caring for someone who, like you've got a daughter or son, you've got a parent that has COVID and you need to be off work to care for them. And then, as we talked about earlier, the expansion of this FMLA program that allows for you as an employee or your employees to be gone in a protected leave because their school's closed or because their child care provider has closed and they don't have a place to receive child care. So the last one is kind of a catch-all. We haven't seen that applied yet, and so we'll let you read that on your own. Here are the pay requirements, and we'll do this quickly. For employees' own exposure, meaning their own health condition, that's number 1, 2, and 3, then the employee is entitled to 100% of their regular wages up to a maximum of $511 per day. So that's the max. You can pay more, the employer can pay more than that, but they can't get reimbursed more from the payroll tax credit than more than $511 a day. For a leave related to family member or school closing or child care, it's 2/3 of that employee's regular rate up to a maximum of $200 a day. And there's also an aggregate amount up to either $2,000 or $12,000 depending on the leave time. So you'll want to check on those. Full-time employee, again, receives 80 hours of leave. Part-time employees receive prorated leave. If they're a 20-hour week employee, then they would get half of the leave, so that might be 40 hours of leave instead of 20. And then the expanded FMLA, this number 5 on your list, for absence related to school, the employee only has to be employed for 30 days. I should say on the first category of sick leave, there is no time limit. Under the FMLA, they have to work for a year, have to work a certain number of hours. As long as they're employed on the day they're seeking leave, then they're going to be covered. For expanded FMLA, only 30 days of employment, and it's not number of hours worked, it's just 30 days on the payroll. Up to 12 weeks of protected leave, just like the FMLA. Those first 10 days are unpaid, but we can substitute PTO, sick leave, other types of benefits that are available. And again, the employee's paid at 2/3 of their regular wage, up to $200. And again, you can supplement that with additional compensation, but the 2/3 is all you can get reimbursed for up to that maximum of $200 a day. Okay? So, you want to cover?
Yeah, go.
So we want to talk a little bit about policies. You need to be thinking as you're returning people to work, and I'm sure you've already been thinking about this, but both Kristi and I firmly believe that you need to have clear communication in writing for 2 reasons. 1, you want people to know, and 2, because you want to be able to prove that you took all these reasonable steps to communicate with your employees what was expected of them, A, so you can hold them accountable, and B, so you can avoid liability, right? A lot of these things we're doing, like temperature checks, or we're doing assessments, or we're understanding what's going on with their health condition, we're asking questions. Those are things that we need to do so we can try to avoid the spread of the infection, and we can say we were a reasonable, purposeful employer as it relates to compliance with these COVID-19 obligations. You want to jump in?
Yeah, just to add that it was May or June, I think it was June, that Governor Stitt signed the legislation into place that basically said if you have these policies, if you're aligned with that hours plan, then you've got some protection from a liability standpoint to protect against a member of the public or one of your employees suing you if they were exposed or claimed that they contracted COVID at your place of employment or your business.
Right.
So that's another reason that just further expands what Kirk was saying. That's another reason why we really want to make sure that you've got these policies in place to take care of your people, but also to protect you.
Yeah. And again, you want to be clear, like, what about travel? What about traveling outside the state, what are the limitations that we can put on people as it relates to those issues? Because everybody's having these questions and thoughts, and so we as the employer need to be really clear. It's our job to communicate. It's not the employee's job to guess. It's not the employee's job to try to figure it out. It's our job to create an environment where people know what we expect. If they're going to go travel to Florida, we want to know that. And we want to have the ability to say, no, we can't do that right now, or yeah, it's okay, but you're going to have to quarantine for 10 days or 14 days or whatever our policy is at that point. So again, it's our job to be really clear in our communication, for sure.
And I think this is actually a great way to wrap up, because my point that I want to make there is that this is changing all the time.
Every day.
The Department of Labor guidance, the EEOC guidance, that's all changing so frequently.
Correct.
Will you hit that next slide? Because this is one of my favorite sayings that I've seen recently. We're building the plane as we fly it. It's a little dangerous. But that's what we're doing, right? We're putting this together as we go.
There's never been a pandemic like this, and especially that's affected so many people at work and how the workplace has changed.
Yes. So I want to end by reminding you that we're going to make mistakes. We're all going to make mistakes. We've already made mistakes. We're going to make more mistakes. Correct it and move on. Do the next right thing, one foot in front of the other. If you need help, call somebody. There are lots of resources out there to help you right now. But I want you to cut yourself a little bit of slack as a business owner or leader. Do the best that you can, because we're all figuring it out as we go.
Right.
So our last slide says, don't forget to put your own oxygen mask on first. You know, when you fly in a plane, they tell you put your own oxygen mask on first before you help somebody next to you. If we don't take care of ourselves, if we don't fill our buckets, then we can't pour into other people's. So make sure that you're doing that. Make sure that you're taking care of yourself, so that you can take care of your people.
Absolutely. Good word.
Yes. Good. Okay, so I think that's it for us.
Yeah, perfect. Thank you guys for your time. It's been fun being with you.